In today's healthcare environment, one of the main goals is to keep the patient out of the hospital. And that's for financial reasons, it's for outcome purposes, it's also for the patient's quality of life. We want to make sure that they're able to stay in their home. And one of the ways that we can do that is by providing home care services. And home care services are skilled intermittent services, are provided on an intermittent basis. So a nurse, therapist, home care aide would go out to see the patient, provide the services that they need. They don't stay with the patient for a set period of time. They go out and provide an assessment, keep the physician informed, provide a task, so maybe IV therapy, wound care, catheter care, that sort of thing. We can also have a therapist see the patient and do therapy in their home so that they don't have to leave their home for that therapy. That would be speech therapy, occupational therapy, physical therapy. We can also have a home care aide go out and see them and provide them with a bath. But again, that's different from private duty care, where the provider is paid an hourly rate to stay with the patient for a particular period of time. And hospice services is similar. Hospice care involves a nurse going out. They also provide bereavement services and volunteer services, pastoral care, and social work services. And all of those individuals can go out into the patient's home and support not only the patient, but also their family, which is very important. One way that home care and palliative care can work together is that when a patient is identified as a palliative care patient, home care can assist the physician in keeping that patient at home where they need to be. And that is so very important, because the goal for these patients is not to continue to go in and out of the hospital in most cases. The goal for these patients is to be as healthy as I can and at home. And a couple of ways that we can do that is to provide the nursing services, obviously, to continue to do the assessments and inform the physician, but also to prepare that patient and their family to provide self-care, to do the things that they need to manage their illness at home and prevent hospitalization. Telehealth. We have many patients right now who are on our telehealth system, and they are palliative care patients. These are patients who have said, I don't want to go back to the hospital. They're not yet ready or qualified to be a hospice patient, but the telemonitor allows us to catch their exacerbations that are going to happen because of where they're at with their illness, to catch those exacerbations early and provide treatment, maybe a as-needed medication or an extra visit to notify the physician of something that's going on, and intervene early so that they don't end up going back to the hospital. I would like the physicians to know that home care can help them to keep their patients out of the hospital. Home care can help to identify the needs of the patient in their home, because we have a very unique perspective. We see all of the pill bottles that are under the sink and in the cupboards and under the bed or wherever they happen to be. We see the unsafe stairs. We see that the caregiver who tells the physician, yes, I'll do everything, isn't really doing everything. We're there. We see the patient at their best and at their worst. And we see their home environment. We see their family dynamics. We see their 5 cats and 3 dogs and whatever else happens to be going on. And we can help to identify those issues and not only provide medical care, nursing services, therapy services, home care aid services, but our social workers can also help to get those patients the services that we need, because we know that many of these patients who have a need for palliative care have a lot of social issues going on. They need food, they need transportation, they need mental health services, and we can help to get that coordinated. That's one of the things we're very good at, helping to get the patient's life coordinated. We're not magic, but that's one of the things that we can assist with. We have social workers who are home care employees, and they are actually working in some of our physician offices and assisting our physicians with those social issues that some of our patients encounter. So our home care patients, or our home care social workers, are able to see patients in their home, but also to see patients in the doctor's office. And that's really been beneficial for the patients. It's also been beneficial for our social workers, who can provide a different perspective, and it's been a benefit to our physicians because they didn't have that service available in their offices. And we are working on a pilot program right now to increase our use of telemonitors and really get our patients and our case managers engaged in using the data that we receive from the telemonitors and incorporating that information into all of the services that we provide. So the nurses, the therapists, the home care aides, the physicians, so that everyone knows what's going on with the patient. We have software in the home health setting that will look at the patient's assessment criteria and tell us if this patient meets criteria for hospice care, for palliative care, so that we can get those patients into the right level of care. If we have a patient in the home health setting and we think they might be appropriate for telehealth, maybe they have a chronic illness, COPD, CHF, diabetes, maybe they've been in and out of the hospital a lot, maybe they have extra self-care support needs. Maybe they need someone to tell them every day, hey, maybe you need to take your medicine, or why is your blood pressure too high today? Maybe you need to take your medicine, early in the morning or whatever. So it's identifying specifically what that patient needs at that particular time. And we need to make sure we're providing them with that and that we're explaining to them why they need that care. Not just, hey, Mr. Smith, do you want to have a telemonitor? But, hey, Mr. Smith, you would benefit from a telemonitor because you have heart failure and need to weigh every day, and we can help you to understand how you can manage your heart failure better and keep you out of the hospital. So that's another way to get the patient engaged and get their buy-in, to make sure they understand why we want them to do the things we need them to do, not just do it because I said so. Patient engagement is so very important. Nothing that we do as healthcare providers is going to be successful unless the patient is engaged. We can go out and provide as much education as we want and give the patient all of the right medications and all of the right tools and equipment, but if they're not engaged and prepared to use that information, use that equipment, take their medications, nothing that we do is going to impact them. So it's really important to help the patient to understand how what we're asking them to do, what we're providing them with, is going to improve their life. We need to identify, what is your goal for care? If our goal for care for that patient might be stable heart failure. We want the patient's heart failure to be stable. But for the patient, their goal might be, I would like to be able to breathe well enough so that I can go to my daughter's wedding. So we need to identify what is motivating that patient. What is gonna turn on that light bulb for them so that they're going to be doing all of the things that we need them to do to achieve stable heart failure, which will also get them to their daughter's wedding or allow them to go back to work or whatever it is they're trying to accomplish. And some of the tools that we can utilize for self-care management and patient engagement are identifying barriers. So if we have a patient, for example, who's not checking their blood sugar regularly and we need to really dig in and identify what is stopping that patient from checking their blood sugar. Is it that they don't know how to use the monitor? Is it that it hurts when they poke their finger? What is it that's stopping them? And then it's our job as healthcare providers to help eliminate those barriers for them, help them to work around the barriers, and not just to remove the barriers for them, but to help them to learn how to solve their own problems. Because if we constantly solve all their problems for them while we're there with them, the time that we're not with them, they're not going to be as successful. Because we're with the patient a very small percentage of time compared to the rest of their life. So we need to identify, how does this management of this illness, how do these things that I need to do to manage my heart failure, my diabetes, my COPD, how do these pieces fit into my life? How can I still be me and check my blood sugar every day? How can I still be me and weigh myself every morning and eat a low-salt diet and all of these things that the patients need to do? And it's our job to help figure out how this thing I need you to do as a patient fits into your life so that you'll do it. Because if it doesn't, and if we don't help them to figure that part out, they're not likely to do it. And then they're going to get into that cycle of not feeling well until it's time to go to the hospital again. Well, to measure overall success, I think ultimately our patient satisfaction is very important. We want to make sure that our patients feel that we are providing the services that they need, that we're communicating the way we need to be, and that we're all on the same team. We don't want to hear from our patients, do people ever talk to each other? We want to make sure that we are communicating well with the rest of the team so that the patient feels cared for. And that, for me, is the most important thing. We also measure success with our publicly reported outcomes. Those help us to know, kind of get a feel for where we're at with providing the care that we're providing. We also look very closely at the rehospitalization rate. That's sort of on everyone's radar right now. For the reasons, that I mentioned, we want to make sure that our patients are able to be at home where they're comfortable and safe and feel like themselves.